And on these fascia pharyngobasilaris, externally allocated muscles of the pharynx. We have three constrictors of the pharynx: superior, middle, and inferior. Constrictors, they are paired, and on midline, posteriorly, they fuse and form raphe pharynx, the site of sew, connective tissue sew is formed, site of connection, like linea alba. Here we have raphe of the muscles. What muscles? Inferior constrictor, middle, superior, they have different levels. Inferior starts from thyroid cartilage, middle from hyoid bone, superior from the mandible and the maxilla from inner surface start. But they don't reach the basilar part of the skull. That is why some part of the fascia pharyngobasilaris is visible. This fascia in upper part is not covered by muscle. Constrictor pharynx is superior, middle, inferior. And one inferior overlaps middle, middle overlaps the superior, and superior don't reaches the base of the skull. And under the muscle you can see the framework of pharynx, fascia pharyngobasilaris, on which they are attached. Like these constrictors, narrowing muscle. Constrictor, it means narrowing muscle during swallowing act. Starts what phase? Pharyngeal phase of ligation, and it is tube about 20 seconds. Not 20, shortly, 20, 40 seconds through the esophagus passes. 2-3 seconds and immediately passes through the constrictor pharynx. And we have also longitudinal muscles which shortening muscles. At musculus stylopharyngeus, this muscle, stylopharyngeal muscle, and salpingopharyngeal from the eustachian tube cartilage. That palato and salpingopharyngeal, stylopharyngeal muscle, they are longitudinal. And these are constrictor pharynges. And externally, organ is covered by connective tissue sheet or tunica adventitia pharyngeus. And then on the 6-7 level, it continues with esophagus. Remember, around how many openings, conduction, communication has the pharynx in a whole? All pharynx, no nasopharynx. Oh, how many? 7. 4 in upper part, 2 pone, 2 eustachian tube. 1 fauces, 1 additus, and 1 esophageal organ, connection with esophagus. 7 openings, 7 communication. Around the fauces lies between oral cavity and fauces is border between external environment and internal environment. On the border between external and internal, we have protective structures, immune tissue, communication, accumulation, immune lymphoid tissue accumulation. They form so-called lymphoepithelial Pyragov-Walder's ring, lymphoepithelial ring around the fauces. It is composed of 6 tonsils. What tonsils around the fauces we have? What tonsil is below? Lingualis. On both sides, tonsilla palatina. This upper part of the pharynx, which starts from the base of this part of the pharynx, like arch. Yes, it is called fornix pharynx. Vault of the pharynx, and here under the mucosa we have tonsilla pharyngea. Below tonsilla lingualis is unpaired, tonsilla pharyngealis. This pharyngeal tonsil is also incorrectly called adenoids. It is not adenoid, it means gland, but it is not glandular tissue. It is lymphoid tissue, but very good expressed at children until 5-7 years, and destroyed breathing through. It hangs from the vault fornix on the region of what? Juana, and destroyed breathing, especially during sleep, and they cannot freely breathe, and remove these adenoids by laser treatment, and can treat this, or surgically remove this tonsilla pharyngealis. It was very good expressed. Adenoid phase is developing at these children, and hypoxia of the brain may be developed, which is very bad for development. And we have also on both sides where this eustachian opening we have, near this opening under the mucosa, we have tubarian tonsils. That's around the fauces. If you draw we have meeting late. Так, this uvula, arcus palatoglossus, behind what we have? Arcus palatopharyngeus. What tonsils here we have? This is soft palate. Levator and tensor, да? And musculus palatoglossus, palatopharyngeus, the same on this side. And here we have tongue. And here what tonsils we have? Tonsilla lingualis. Above this, above and behind, that is where palatine. On both sides we have palatine. On both sides we have palatine tonsils. Tonsilla lingualis, tonsilla palatina. Above we have pharyngeal. It is called tonsilla pharyngealis, pharyngeal. And tonsilla tubarian. On both sides. Ой, это не там. No, approximately also вот так. Inside. And we have this ring of 6 lymphoepithelial ring. Around the fauces we have this lymphoepithelial ring. No, here, on lateral sides we have lymphoepithelial, this ring of immune tissue. And esophagus. Esophagus starts from the 6-7, the first nerve ring, until 10-11 thoracic. From cervical, this organ has about 20-25 centimeters length, and it has cervical portion, thoracic portion, abdominal portion. Cervical is very short, 6-7. One vertebra, cervical vertebra, low margin of 6 up to 7. In front lies trachea. I forgot to say behind pharynx. What organ? In front we say behind pharynx and behind esophagus. Continue cervical part. What we have? The cervical vertebra, but no this free vertebra located behind. They are covered by. Do you remember ligamentum longitudinale anterius in front, and also deep muscles of the neck? Prevertebral group of the muscles, the deep muscles of the neck, musculus longus colli, longus capitis, rectus capitis, lateralis et anterior, covered this vertebra in front and covered by prevertebral fascia. And these prevertebral muscles, fascia and vertebra lie behind pharynx. And on both sides we have neurovascular complex of the neck, consists of vena jugularis interna, arteria carotis interna, and nervus vagus on both sides of the pharynx, the main vessels and nerves of the neck. They are located on both sides of the pharynx. We have parapharyngeal space between wall of the pharynx and inner surface of the angulus mandibulae, musculus pterygoides medialis, and styloid process with the branch of the ligaments and muscles. But also we have a retropharyngeal fatty tissue space. The posterior wall of the pharynx, connective tissue, adventitious cord, is separated from prevertebral fascia and muscles by means loose connective tissue, and lymphoid nodes are located here. It is called retropharyngeal space, which is easily separated from the vertebra, and angina sometimes maybe have this complication, a retropharyngeal abscess may be very difficult. Cat surgeon and the pus may be accumulated here, which can, through the retropharyngeal space, continues into the thoracic cavity, into the posterior mediastinum. Thus, in front of the esophagus lie trachea, behind the same vertebra, prevertebral muscle, cervical portion, and the vessels, nerves on both sides. Thoracic part at first passes in upper and then in lower mediastinum. Thoracic part, remember, mediastinum is part of between two lungs. Heart, esophagus, vessels, nerves lie between two lungs. It is organ of mediastinum. At first superior, then posterior mediastinum, and relation with aorta, thoracic aorta. It is important to know thoracic aorta at first lies on left side, then behind, then right side of esophagus. and esophagus with the vagus nerve passes through hiatus esophagus of diaphragm and then goes in abdominal part, is covered by peritoneum. On transverse section, it has star-shaped lumen of esophagus because here are very good developed the submucous layer, and inside it has longitudinal folds, and star shape. So, my dears, I have to meet to your department.